Hello, and welcome back to this episode of the Kumbay'all podcast. I'm so excited to have you here with me today with my very, very good friend, Nicole Schwartz of Beyond Birth Collective. She is a lactation consultant, and I am absolutely so pleased to have her with us today. I cannot wait for this conversation. So let's just dive right in. Nicole, I would love for you to tell us about yourself and your journey to become a lactation consultant.
Hi, Amanda. Thank you for having me on the podcast. So I had my daughter in 2012, and I was not a lactation consultant at the time. She was my first child, and I remember going into it thinking, okay, I want a breastfeeder. I want to try. I don't think I'm going to like it, but I'm going to try. So I took a prenatal class and I was like, okay, this will be easy, right? And well, we had a really difficult journey. We had struggles for about 3 years. I saw lactation consultants. I was dealing with some postpartum mental health things, and it was really hard. And at the time I was working in healthcare, but I wanted to do something different. I was on the administrative side of things, and I had been kind of searching for a different career path. And I remember thinking, okay, after we got past the 3 months and things started to go better for us, I really started to love breastfeeding. And I surpassed my goal of getting to a year. And then I kind of became addicted to breastfeeding. I just loved learning about it. And I'm like, okay, maybe I want to help moms breastfeed. So I started looking into it, and the rest is history, I guess.
Yeah.
I have a biology degree, so I had a science background. So I had a lot of the coursework done already. I just really started, I did my hours, my clinical hours, and was studying on the side while I was taking care of my daughter and working. And I just loved it. So I guess it's, a lot of us end up in this career kind of the same way. It's something we come to later in life after we've been through our own experiences breastfeeding. And yeah, that's how I got here.
Yeah, I have to say that you are an absolute gift, and I really, truly believe you found your calling because you're magical. and I truly mean that. You guys, Nicole is a really dear friend of mine, but she helped me with my second baby. My first little one, I had zero issues with breastfeeding. Really none. And so when I was preparing for the second baby, we literally had gotten rid of all the bottles because my first daughter did not take to a bottle. So I just breastfed the entire time. I did have my pump, so I kept that. But we literally did not have any bottles. We didn't have anything because I just thought, oh, we're not even going to bother. I'm just going to, do kind of the same thing. And then, excuse my language, but shit hit the fan, and like, Nicole, help. So I'll get to that. But so I guess my first question is, why should anyone see a lactation consultant individually? I feel like there is so much information on Instagram and Facebook moms groups and social media in general that it almost seems like people think that they can just kind of DIY it, right? And there's so much, I think it seems like, good content put out there. So what would be the benefit of seeing someone individually?
Yeah, and back in 2012, I don't remember. I don't even think I was on Instagram when I had my daughter. I think I was on Facebook in some groups, and it is helpful to have peer-to-peer support and definitely have talk with friends that are going through it as well and can give you tips about breastfeeding. But, there's just so many individual things that are nuanced. No mom I work with is the same as the next mom. There's always, and I'm always learning new things, and I'm seeing new things. And, some things it's like Dr. Google. You can Google anything and you're going to get a million answers. There is good, education out there, but then there's bad. And so you don't always know if you're getting the good information or the bad information. And I have a Instagram page and I put out a lot of content, and there's a lot of great IBCLCs out there and lactation educators. But, sometimes you might be following somebody that's not giving, research-based information or just old information. And, it might not apply to you. And you might think it does, but it doesn't.
Mhm.
So, when I see somebody individually, they have my full attention. I'm getting a full history, of them and their baby. And that I ask a lot of questions. So I think lactation consultants are kind of like detectives. We have to get a lot of information, and that can tell us a lot of different things. And nobody has the same medical history, the same birth story and history. There's so many things that can play a role in what's going on in your breastfeeding journey.
Mm.
And that's where getting individual support is really helpful. And then we give you an individual care plan. And I stay in close contact with all my clients. I'm checking up on you, and you get somebody there that is along with you on the journey. So
I appreciated that too. And I worked with you, how you were texting me. It wasn't just me texting you and reaching out with questions or when things popped up, but you really were so attentive and so just checking in all the time. And that really speaks to me about how every person is different, because I see the same thing in my practice where, you can learn that exercise, you could do this, but something that you found on social media, but the benefit of seeing a pelvic PT sounds like just with a lactation consultant is that individualized assessment. You're actually looking at their boob or their nipple shape, or just even anatomically the nuances. Yeah, where that's different. And the same with us, like we're looking at what their body is showing us in that moment and what they need right then. So maybe that exercise would be great, but not right now in a little bit. And so.
And there's some great general, information you can get out there, of course. But especially if you're having a difficult time, every dyad is so unique. And, even from baby to baby, like you said, you had 2 totally different nursing experiences. So I see a lot of moms that are on their 2nd, 3rd, 4th baby, and they didn't have any issues with the first 3 or the first 2. And then this little individual person comes along and everything changes. So, it's not just for first-time parents too. So every baby is different.
Absolutely. Absolutely. And it makes so much sense. But I think that's the old paradigm is with regard to parenting and just how we view children. I think in general is that, seen but not heard. And they're not really themselves until they're older, at some point. But no, they're really their own little being, their own little person, and so individual right from the get-go. And so that really makes a lot of sense. So what if so I had 2 home births, so this was not an issue for me. But if you give birth in the hospital, I hear a lot of people say, oh yeah, well, I saw the lactation consultant in the hospital. So why is that enough? Is that not enough? Why?
And you should definitely ask to see the lactation consultant in the hospital,
Okay.
And say, you want that help, they can help you if you're having a hard time latching baby, or they can tell you how the latch is looking, or just give you some encouragement. But really, once you go home, it's like a totally different ball game. So the first couple days, your baby's going to be sleepier, and you still have your colostrum. So you have, small quantities of milk, and, you're both recovering. So when you get home, your milk starts coming in. You don't have the nurses there checking on you. You're doing it yourself. And things change really quickly with babies. So, you might think you're catching your baby's feeding cues, but you're really not. Or you may think they're getting milk, but they're really not. And just so many things can change very quickly with babies. So it's always like super helpful to have somebody lined up that you can see once you get home, like in that first week. It's kind of like they tell you, okay, get your baby to the pediatrician within like 48 hours of leaving the hospital. Well, that's to do a well check, right? Because things change quickly. And so feeding should be the same thing. And your pediatrician can, check the well-being of your baby and see that they're gaining weight, but pediatricians aren't breastfeeding experts. There are some that are IBCLCs and that have taken extra breastfeeding education, but that's not their primary focus. So, and they're there to take care of your baby. So they're not going to be able to help mom that has cracked and sore nipples or is wondering if her milk came in. Right. So there's two people. It takes two people to breastfeed, right? So both of those people need to be taken care of.
Absolutely. Absolutely. That's where we had the trouble with Annika, with my second, was that it was in between pediatrician visits. It was between like her first and her second visit, or maybe in between her second and third. You have two right in the beginning. And then I remember they measured her and she was fine and her weight was doing okay. And then I remember it was like a Thursday or Friday, and then it was going to go all the weekend until like the next Wednesday was my appointment. And I started noticing that her pee diapers were less and less. Like they were increasing for a while, and then all of a sudden it was less pee diapers this day and then the last day. And so I was so appreciative that you came over with your scale and immediately could tell me, yeah, she's not getting enough. You're not getting your milk in. And we ended up supplementing for about 4 days, maybe 5 days. It wasn't that long, but it felt like an eternity. You feel awful. And I remember you were so kind and so gentle with me. You're just like a mental basket case at that point anyway, with all the hormones. But yes, and I just could not help myself thinking, if I didn't have you already on my side, part of my team, what would I have done? Even if I had made it to Monday to call and move my appointment up to Monday, that baby would have gone, Saturday and Sunday without getting enough milk. And then I'm stressed out with her crying all the time. And I just knew something was wrong when her pee diapers were less, or like the pee was more yellow or something. And I just knew, something wasn't good. So yes, absolutely. And I know here at Renew Pelvic Health, we really believe in prevention, and we love to work with people before issues arise. We love to work with people before they have elective surgery, if it's coming up, obviously, or even before they have their baby, during pregnancy. I would love to hear your thoughts on seeing a lactation consultant during pregnancy. So even before you've technically begun your breastfeeding journey. Do you believe in that? And obviously I kind of know the answer, but why, like what would be some things that you could work on, you could help someone with during pregnancy?
Absolutely. I get so excited when people contact me and they're like, I'm still pregnant, but I just want to have a prenatal. I'm like, yes,
It's like, yes.
So this is great, educating beforehand. And it's just, the biggest thing about that for me is like giving them the confidence to go into it. And, we all have ideas in our head about how the birth is going to go and how we want it to go. But the reality is sometimes it doesn't go that way. And, and the same is for breastfeeding. We might have intentions of exclusively breastfeeding, but, maybe we had to have an emergency C-section and then our baby was separated from us. There's just so many things. And I don't do scare tactics, but it's like, okay, this is our plan going into it. This is plan A. Mm-hmm. But if something goes awry, this is our plan B. Because I think that's a lot of times in the beginning, like those first couple weeks are so important for setting up your milk supply. And that's like those foundational days are so important and you can't get those back. So I think a lot of times, parents think, oh, this is going to be easy, right? You just put the baby to the breast. And then something happens that they weren't planning on happening. and then they don't know what to do. And in that moment, you're sleep deprived, you're tired, you have this new baby that you're taking care of, and like all these things going on, and you just can't think clearly. So having a plan going in is so important. And you don't know what you don't know. Like, you can read books on breastfeeding. My prenatals different than other people's. I have an hour and a half with you, so I like get down to the nitty gritty. Okay, these are the important things you need to know about the first couple days to get you through those first couple days. And this is how milk supply works, and these are things to look out for with your baby, to tell you that they're getting enough milk, and some of the most important things I teach are hand expression. Enough women do not know how to hand express. And it's so helpful in the beginning and those early days for getting your colostrum. And it sometimes when your baby's not latching, that's the only way you can get milk out. And so, just teaching women that and having them get comfortable with that before the baby comes. And some women too are interested in expressing some colostrum before their birth. So we can discuss if that's a good idea for them or not. It can be safe for some women to do that. And then,
you don't blanket, you don't say like it's safe for everyone though.
Right. If you have a high risk pregnancy or certain situations, it's not recommended. So that's not something I suggest you just go and do without talking to either an IBCLC about your specific situation or your OB. But for some moms, it can be, especially, there's been a study, they did it with women that have diabetes, and they had good outcomes, and they found that it was safe to do. So there's some circumstances where it is helpful. And then also just, getting a relationship with a lactation consultant. So you're not on Google panicking, you're about to leave the hospital and you're about to go home and you need help, and then trying to find somebody. So you already have me in your phone. You can text me from the hospital. Hey, I had my baby, let's set something up. So that takes some stress off of you. And we've already met. So there's more of a comfort level. And I know your full medical history. And that's another thing too. Like, I get a full medical history during my prenatals. So if there's anything that's a red flag or that might predispose you to low milk supply, then we know that right now. So we can have a plan again. It's all about a plan and having confidence. And then also along with that is kind of just like having that reassurance that you know what to do. So.
I totally agree. And it just makes it so much more seamless going from, okay, I've had my baby, send a text, we're on our way home. When should I check in with you? Or like you said, and just knowing that they've met you before. I do tell all my patients, I try to get everyone to work with a lactation consultant during pregnancy. As soon as I know, as soon as, someone who's pregnant comes in, I always just say, get this started. It's kind of like pelvic health, right? Or pelvic region in general. In our society, we have such a taboo and shame around the area. We don't talk about it. We don't get help. Well, it's kind of like breastfeeding as well. We don't see enough people breastfeeding in public or even in private. We just, it's something that we don't just know. We don't know how milk supply works. We don't know all the different latches that you can do. And even the like the hunger cues. I feel like I had no idea that. I mean, rooting, you can kind of tell, but there are, now they're not on the top of my head anymore, but, it's like by the time they're clenching their fists, they're hungry. Like you missed it, or whatever the things are. So I just think the more that we support women, it's just,
I've seen I've had prenatals with moms. It wasn't their first, but the first time around, it didn't go well. So, or they had low supply. So they want to know proactively now, okay, this is what happened the first time. Like, this is what I did. What can I do different this time?
Right.
And that's just so empowering when you have this plan and like, you're just not left in the dust.
Absolutely. And I think you said it too, where your OB is there to get the baby out safely and to protect the mom's body. And then you go over to the pediatrician and they're about the health of the baby. So yeah, they've got the scales and they can weigh, but it's not like they're nuanced with how do we feed them through the breast or through pumping and express milk. Really, they don't need to know that because you have formula and they could just say, oh, we'll just make sure your baby's getting enough. But you're that kind of amazing person that can help with that journey and help both the mom and the baby and be an advocate for them both and such a resource. It's amazing.
And, I worked at a pediatric office and the doctors there were super supportive of breastfeeding. Obviously they had IBCs, CLCs on staff, but, their main job is to make sure the baby is healthy. And feeding is one aspect of that, but there's so many other things they have to check. So, and they just don't have the time. Like I spend an entire hour and a half the first visit.
Yeah.
And like, I do home visits too. So I can come to your home and like, okay, show me where you're nursing your baby in the specific chair, like what is actually happening. So it's, nothing like the pediatricians are there to make sure your baby's healthy and safe, but they can't dig in deep with you on the lactation part. Yes. And you're feeding your baby, 12 times a day sometimes, it's a big part of your life. And the thing I hear most often from new parents is like, I didn't know it was going to be this hard. Yes. Like I had no idea. Like I thought you just breastfed your baby.
Yeah.
Pop them on there.
And I didn't grow up on a farm and knew about colostrum and, we bred goats. And so I kind of knew some of that stuff, but I did not know anything about, like the milk supply and all that. And it's just, we don't talk about it. Like you said, we don't know. And it's this, women, we need more support. There's no problem with getting support. And I feel like this is an area that is just, we need more help.
And when's the last time you saw somebody breastfeeding in public?
Yeah.
Like it's so rare that I see it that I actually get so excited. And then I go up to the mom and I probably weird them out, but I'm like, thank you for breastfeeding in public.
Yes.
I'm a lactation consultant and sometimes they'll just look at me like crazy. But
I'm guilty. I'm literally guilty. We just went to Fernbank today. We're here in Atlanta. Went to Fernbank and my 2-year-old was losing her shit. Like she's like, I don't usually swear this much, sorry. But so she was losing it. And, I was like, okay, it's almost lunch. I know you're hungry. And so we went to the bathroom. I think we went to wash our hands. And then I thought I could go out there, but it was right at the opening where, the entranceway where people are coming in and stuff. And I said, I literally squatted on the ground and she's just kind of sitting on my lap. I'm breastfeeding in the bathroom. And the lady is coming in and emptying the garbage and wiping down the counter. And so I'm like squatting I did not sit on the ground. I wasn't touching the ground, but I'm still like low to the ground. And I'm like, hey, sorry. And she's just laughing. And I'm like, oh my God, why am I not out where there's maybe a chair or there's some other place? But it's just so ingrained in us that I do like the double shirt method, right? So you have the nursing tank top underneath and the shirt on top. So you really are not showing anything, like your belly's fully covered and the shirt comes up and it's just amazing, like how ingrained it is that we just don't do it. So people, and then it's perpetuating that. It's awful, I know, but.
And I've worked with people that are from Europe and they're like, in Europe, everyone just like wherever they were from, I can't remember. They're like, there we just breastfeed our babies. Like it's not a big deal.
It's not sexualized. It's not
breastfeeding. It's normal.
Yeah.
And I remember when I was pregnant, I had a couple friends that just had babies, so they had been breastfeeding. So I was exposed to it, but it was weird. Like you almost feel like you can't look or I don't know. It's just the way it's still seen here that it needs to be private, And I think that it's hard. It's hard then for us when we have our babies, because then we think we have to hide away too. And we don't know even what it looks like to breastfeed.
Right.
So,
Yeah. And when they're really little, it's all about the latch and getting them just right, and then trying not to get back pain because they're so tiny, right? It's like you gotta get them up to you, And then when they get older, I remember with Solène, with my first, I was actually afraid. Like I was actually scared when I would go out if she would fuss or something, or she'd want a nurse, because she would just like pull on my shirt. And I remember there's so many times I would wait in the car or go back out to the car so I could have air conditioning, but I could sit there because I was so afraid she was just gonna like pull off or expose something, right? Now I don't have that feeling inside anymore, but I still, just out of habit, will do it in a bathroom or do it somewhere, even if I don't have a seat, where I'm kind of like turning away and anyway, it's hard to break the habit, I guess.
Yeah.
So I would love for you to share with our listeners your top 3 myths or misconceptions that you hear from clients or that you see going around on social media.
I guess my first one is that it's normal for breastfeeding to hurt.
Mm.
And when I say breastfeeding, I'm also talking about pumping. Parents now choose to exclusively pump. And so the same goes for pumping. Pumping's breastfeeding. You're still supplying your baby with your milk. Mm-hmm. But there's this idea that it should hurt. It's normal to hurt. Like I have sore nipples. It's just like this rite of passage.
Yeah.
And I'm like, where did this come from? We are mammals, right? And it doesn't as a biologist, it doesn't make sense that biology would have us doing this thing to feed our babies that would be painful. Like it shouldn't be painful to feed our babies. So, and pain in general is our body's way of telling us that something's not right. Hey, pay attention, something's not right. So in the beginning, there is some transient soreness, and there's a difference between like having some soreness because all of a sudden your nipple's being stretched, right? Like it feels like a vacuum. It should feel like pulling in a vacuum. And you might have some transient soreness, but if your nipple's coming out looking like a lipstick or like white or bleeding, that's not normal. So that tells us something's off. It could be the latch, it could be we have to shift positioning, or it could be something more like your baby has a tongue tie. So, these are all things a lactation consultant can look at with you and help you figure out. So it's not normal to have pain. Another myth is, and this is something that's kind of gotten perpetuated, I think, on social media, because we all see these pictures now of moms with huge freezer stashes. And this freezer stash has become a thing. And you don't need a huge freezer stash. Like, some people feel it makes them feel safer, like in case there was an emergency or in case, we have this idea that all of a sudden we're going to magically lose our milk supply. There's always a reason. If your supply starts to dip, there's a reason. It's not normal for it to just all of a sudden your milk to dry out. So if that's happening, then you need to find support to help you figure out and get to the root cause. I'm all about the root cause. Like there's always a reason for something. And I would like to dive deeper and figure it out. So freezer stashes, you don't need hundreds of ounces in your freezer. You don't need your freezer. Even if you're going back to work, really all you need is like to be safe a couple days worth. So it's our body likes to conserve energy, and milk making is a high energy process. Like it takes our body a lot of energy. And it actually takes more energy to make milk than to run our brain. So, we don't like to waste. So your body's going to make as much as your baby needs. And so having all that extra in the freezer is just, I don't know, it's become this thing with pumping to have all this extra. And you don't need it. And some, people that are just exclusively breastfeeding, you don't need to pump. So that's a myth. And I don't know where that kind of thing came about, but
yeah.
And then another myth is breastfeeding is all or nothing. So, everybody makes their own choices, their own parenting choices, what's right for them. And just because I'm a lactation consultant doesn't mean I'm anti-formula or anti-bottle feeding or anti-pumping. I'm here to support families that make all kinds of choices. And so, sometimes you have to do a combination of both. If you're a working parent and you have to leave the house, you have to pump. Unless you can go bring your baby to you every 2 or 3 hours, it's a necessity. So sometimes it's going to look maybe different than you thought it would look, but it doesn't have to be all or nothing. It can be a little bit of breastfeeding. You can do combo feeding, whatever's going to work for your family and your situation.
That's great. That's absolutely great. And I guess what I'd just like, if there's any other final thoughts or advice that you'd have for anyone, I really appreciate your time and everything that we've talked about so far. Are there any kind of parting words you can think of?
I guess my biggest thing is don't wait to ask for help. And, getting breastfeeding support should be preventative medicine. So
love it.
Schedule a breastfeeding wellness visit. Like after your baby comes, have somebody come out and just, hey, how's it going? How's the latch look? What questions do you have? You're always going to have questions, and they can give you the education. They can help you feel supported. They can be there when you need something, because something's always going to come up along your journey.
Right.
And if you're struggling, don't struggle alone. Don't wait to ask for help.
Right.
With breastfeeding, especially, a lot of times, if we can meet with you and get things solved, like right when they happen, it's easier than like, okay, we've gone 4 months now.
Yeah.
And you're still having pain, or, you've lost your milk supply. It's going to be more work and harder to kind of figure out how to get us back on track.
Right.
So, getting that help early can make a huge difference, and just, having that support. So.
Yeah, I agree. And for me, it was that week out. It was, things would seem to be going well until they weren't going well. And it's almost anxiety producing for me now to look back at pictures of her in that couple day span, because I feel like she just looked tiny. She looked like she lost weight. She did, but she was like skinnier, and it's apparent to me now, but I'm just so grateful that you were there in my time of need. Absolutely. So how can people find you? How can they get in touch with you or reach out, or if they'd like to work with you?
You can find me on Instagram at Beyond Birth Collective. And then my website I have a blog and information on how to schedule and the type of services I offer. And that's www.beyondbirthcollective.com. Or you can email me at nicole@beyondbirthcollective.com. And I am in the Atlanta area, but I do virtual as well. So no matter where you are, we can meet virtually as well.
And can you help people outside of Georgia or just within Georgia?
Anywhere, even
really?
in another country.
Oh, that's so cool. Oh, yeah, because of our licensing.
Because we are internationally
right.
certified, so I could go work anywhere.
That's amazing. Oh, that's super cool. Yeah. Oh, that's wonderful. Well, excellent. I cannot thank you enough for your friendship, selfishly, but also your professional guidance and really just what you're doing for women in the world, and for your time here today to share it with my listeners, and everyone that gets to hear. So thank you.
Thank you.
Nicole. Take care.
Bye.
Do you ever wish that you could learn the essentials of pelvic health from an experienced pelvic floor physical therapist at a fraction of the cost and from the comfort of your own home? This episode is sponsored by Progressive Pelvic Education, your source for online courses to expand your pelvic health knowledge and promote optimal wellness. Pelvic health is wealth, and there is a lot of essential information about our pelvic floor that isn't taught in school. Learn what to do and not to do to avoid the inconvenience and pain of pelvic floor issues in a self-paced course you can take anywhere. Visit courses.progressivepelviceducation.com to get access today.